Another case of a young man with really bombed out dentition, serious overbite, and you can see with the implementation of the 3D facial scanning from the pre-op, this is not like a post-op scan. This is all designed for him before we ever lay hands on the patient. So I can establish a vertical dimension. I can plan about the amount of bone reduction. I can plan where the implants need to be. I can predict the access hole position. I can widen his smile or make it narrower. There's so much more I can do with the cases before I ever do a non-reversible surgical intervention by using this type of technology. So through, my courses I always teach garbage in and garbage out. So through a really repeatable and precise methodology for data acquisition and planning at the beginning of your case, you will have a more predictable, higher quality outcome at the end of your case. And that's really the goal. There's so much that goes in to these cases. You have to have so much training and knowledge in surgery and prosthetics and occlusion that the last thing you want is unpredictability, right? You want to be able to know that if you are providing this service for patients and they're, trusting you and dedicating their life savings or their credit to you and giving themselves up to your trust, you want to know that unpredictability is not one of the factors you have to deal with. Yeah, if there's a complication, obviously you have to know how to deal with it, but complications happen, pain happens, bleeding happens, broken teeth happen. These things are going to happen. They're out of your control, but predictability should be in your control. You should be able to know that if you follow the recipe from A to Z, that you're going to get a predictable outcome from a predictable method. And that's why Full Arch Masters is so popular, is because we teach you and your team how to have a predictable outcome with a predictable method and not have to reinvent the wheel every time you do this.